He died after waiting 34 hours for treatment in a Winnipeg emergency room.
He assumed he was there because he was drunk or homeless or otherwise not in need of medical care.
He shouldn't have died that way in the first place.
I want to apologize to Mr. Sinclair's family.
He waited for 34 hours, in plain sight of nurses, doctors, patients, and security, and no one helped. When staff finally checked, Brian Sinclair was dead, still in the wheelchair he had rolled in with. This wasn't just a tragedy. It was one of the most shocking cases of medical neglect in Canadian history. If you believe stories like this need to be told, subscribe now to Medical Crime Files, because what you're about to hear will change the way you see healthcare. Brian Sinclair wasn't just another patient number. He was a 45-year-old Indigenous man from Manitoba, Canada. Born in Fort Alexander, now called Sadking First Nation, Brian grew up north of Winnipeg in a close-knit community. His family described him as gentle, soft-spoken, and funny. He loved visiting relatives, attending community gatherings, and playing bingo at the local hall. He had a fondness for country music. Whenever a band came to town, he'd wheel himself right up to the front row, eager to enjoy the performance. But Brian's life was not easy. Years earlier, he developed a spinal infection. The infection was devastating. It eventually led to the amputation of both legs. From that point forward, Brian relied on a wheelchair. His disability brought daily challenges. Brian also lived with cognitive disabilities and limited literacy. Navigating government services and hospital paperwork often required help. He leaned on social workers and caregivers. But those who knew him said he valued independence. He didn't want pity. He wanted dignity. And he fought for it. Despite his limitations, Brian lived on his own in a supportive housing complex. He liked to get around downtown Winnipeg, socializing, visiting friends, keeping up with his community. He had resilience, determination, a will to keep moving forward. On the day he died, he had even arranged his own ride to the hospital. He wasn't asking for special treatment, just the bare minimum, medical care. It was September 19, 2008. Winnipeg, Manitoba. Brian began experiencing pain. His catheter, a tube required after his spinal injury, had become blocked. It was a common complication. Uncomfortable, sometimes dangerous, but easily fixed. A simple procedure, a catheter change, something that could take minutes. So Brian did what anyone would do. He went to the one place where help should be guaranteed, the Emergency Department of Health Sciences Center, Manitoba's largest hospital. Around 2 p.m., Brian arrived in his wheelchair. He spoke to a staff member. He explained his problem, a blocked catheter. Then he was told to wait. No triage, no registration, no wristband. Just a man in a wheelchair, left in a crowded waiting room. At first, Brian sat upright, patient, calm, trusting the system. But the hours dragged on. The waiting room was busy. People coughed, shifted in their seats, checked the clock. Nurses hurried by. Doctors called out names. The fluorescent lights buzzed above. The intercom echoed with announcements. Brian remained, quiet, still waiting. By evening, he vomited. On himself. On the floor. Other patients noticed. They grew uncomfortable. Some even alerted staff, pointing to the man in the wheelchair who was clearly unwell. Still, no one examined him. At one point, security wheeled him outside after he vomited, then brought him back in. Yet again, no one checked. Overnight, the waiting room grew quieter. The chaos of the day faded into eerie stillness. The sticky spot on the floor, where he had thrown up, remained. Brian leaned forward in his chair, hands resting in his lap. Many assumed he was sleeping. By morning, a new shift came in. Fresh nurses, fresh doctors, fresh patients. Brian was still there. Some staff assumed he had already been treated. Others thought he was intoxicated. A few believed he was homeless and simply waiting inside to stay warm. But Brian wasn't drunk. He wasn't high. He wasn't disruptive. He was sick. He was deteriorating. As the day wore on, Brian's condition worsened. His blocked catheter had caused a urinary infection. Left untreated, that infection spread. Sepsis began to set in, but no one examined him. Nurses passed. Security walked by. Patients sat beside him. Some glanced. Some whispered. But no one acted. 34 hours. That's how long he sat there. By the second night, Brian was slumped forward in his wheelchair, his body motionless, his skin pale. Finally, another patient spoke up. They approached a nurse and said, "That man doesn't look well." Staff went over. They touched him. Brian Sinclair was dead. Dead in the waiting room. Dead in the chair he came in with. Dead of an infection that could have been treated in minutes. If you think this should never have happened, leave a comment below. And subscribe to Medical Crime Files, because this isn't the only story where neglect in plain sight costs a life. At first, hospital officials called his death a tragic oversight, an isolated incident. But surveillance footage told a different story. The video showed Brian waiting, vomiting, slumping, deteriorating. 34 hours captured on camera. The hospital claimed he never checked in, that staff thought he had already been treated. But the footage proved otherwise. Advocates, community leaders, and Brian's family pushed back. They argued this wasn't an accident. It was systemic. His race, his disability, his poverty. Those were the reasons he was ignored. An Indigenous man in a wheelchair, invisible in plain sight. The media sees the story. Headlines screamed, "Man dies in ER after 34 hours waiting." Public outrage exploded. Vigils were held. Brian's empty wheelchair was placed outside the hospital, surrounded by flowers and candles. His death had become a symbol. Brian's death triggered a formal inquest. The investigation revealed the chilling timeline. No triage, no wristband, no medical exam, no treatment. 34 hours, sitting in the waiting room, ignored. Staff testimony was damning. Some admitted they assumed he had already been seen. Others said they thought he was drunk or homeless. A few openly acknowledged biases toward Indigenous patients. The inquest did not lead to criminal charges. Prosecutors argued there was no intent to cause harm. Instead, responsibility was spread across the system. But for Brian's family and for Indigenous advocates across Canada, that was a crime. No one was accountable. Brian Sinclair's case wasn't just about one man. It was about how systems treat the most vulnerable. Indigenous leaders pointed out the deep history of discrimination in Canadian healthcare. Generations of Indigenous patients had described being dismissed, ignored, or treated as less deserving of care. Disability advocates pointed out how patients in wheelchairs are often overlooked, assumed to be passive, assumed to be fine if they're not loudly demanding help. And poverty, the way staff stereotyped him as homeless, intoxicated, or unworthy of urgent care, sealed his invisibility. Brian Sinclair was a victim of intersecting biases. Race, disability, poverty, all combining in the worst possible way. The inquest recommended reforms, faster triage procedures, immediate assessment for patients arriving in wheelchairs, cultural sensitivity training to combat unconscious bias, clearer communication protocols between staff. Manitoba later introduced new procedures. Staff were told no patient should sit unassessed. Communication systems were tightened. Nurses were trained to better recognize bias. But to many it was too little. Too late, because Brian Sinclair was already gone. Brian's family filed a lawsuit against the hospital and the Manitoba government. They alleged systemic negligence and human rights violations. The government fought back. Lawyers argued that staff mistakes, not systemic racism, explained his death. They rejected the idea that discrimination played a role, but the public disagreed. Across Canada, Brian Sinclair's name became synonymous with medical neglect. His case was compared to others where Indigenous patients were ignored, dismissed, or mistreated in hospitals. Protests erupted. Human rights groups called for accountability. Brian's death was cited in classrooms, training programs, and activist campaigns. Brian Sinclair entered the hospital seeking help. He left in a body bag. 34 hours. A man in plain sight. Ignored until death. So what do you think? Was this just a tragic failure of communication? Or was it a medical crime rooted in systemic bias? Tell me in the comments. And subscribe to Medical Crime Files, because the next case might shock you even more.